The results of this study demonstrate the potential of filgotinib 200 mg as a viable treatment option for Japanese patients with ulcerative colitis, UC. As the only randomized, placebo-controlled trial in Japan, the selection trial had a generally favorable clinical response to filgotinib 200 mg once-daily induction and maintenance studies, and the results also showed that the dose was well tolerated and no new safety signals were noted. These results suggest that selection may be a useful therapy for Japanese patients with UC.
This article is titled Efficacy and Safety of Filgotinib as Induction and Maintenance Therapy for Japanese Patients with Moderately to Severely Active Ulcerative Colitis, a post-hoc analysis of the Phase 2b/3 selection trial, and was authored by Toshifumi Hibi, Satoshi Motoya, Tadakazu Hisamatsu, and others.
We are www.article.tv. Check out the video description for links to this article.